Just wanted to go back to your estimate and also to ask you in particular, where are you getting your information from? So have you got an inside line?
We haven't got an inside line to anything. I don't think anybody has an inside line at the moment. We have as much information as anybody else. I mean, I think even the World Health Organization doesn't have much more information beyond official statements. So we are getting information by collating information from official government releases in the large part. I mean, we have a large network of scientific collaborators around the world who are helping in terms of all the languages involved, and close links with both the World Health Organization, the US Centers for Disease Control, and of course Public Health England and the UK government. But everybody is basically in the same position at the moment in terms of information.
Okay, and then just go back to your estimate again. So you're doubling your estimate from about 1,700
to about 4,000, and that just reflects the fact that and I should emphasise the cut-off date. We're talking about people who had symptoms onset by 18th of January. That's a few days ago.
Sorry, I don't really understand that. You're talking about, you're saying you estimate that around 4,000 people will have been sick.
Will have been sick in Wuhan and have developed symptoms by the 18th of January. And the reason that's more than double is a very simple, the calculation hasn't really changed. It's because we now have, by that cut-off time, 7 cases reported outside mainland China. So there is a very recent case in Macau, which we haven't included in the analysis just because it went past our cut-off date for doing this. Also, they travelled by train, which we're not. So it would require a significant work to factor in train travel as well as air travel. So if we allow for air travel only, then we use 7 cases. The uncertainty in that estimate is also important. I mean, because we're basing it on, there are a lot of unknowns about connectivity, and also it's still a small number. It goes from 1,000 up to close to 10,000. But still, 1,000 cases is still substantially larger than currently reported numbers. And my feeling is that reflects saturation of the Chinese, response in terms of diagnosing cases, and perhaps the point Peter made that there are people who are still symptomatic but not showing severe symptoms of pneumonia and not necessarily being detected at the current time.
Right, I'm just going to quickly read out some points that David sent over, in case you didn't hear. Apologies again for the technical difficulties. So he says, this is David Heyman. The WHO is coordinating 3 virtual groups that are putting together the clinical, epidemiological and virology information to do regular risk assessments as understanding develops. The groups are on site. China has been sharing data with the WHO, which has made it possible to do risk assessment in collaboration with an external advisory group, which David chairs. The pieces of the puzzle are coming together and will provide information needed to control and model the outbreak. And then says Peter Horby can answer any questions relating to the previous SARS outbreak. So I'm going to go to James next.
Sorry, I was wondering, what's the best we understand about what's happening in terms of the number of new cases at the moment? Because lots of the increases, kind of like better surveillance, of what's already out there. So do we understand what the current rate of infection is with an exponential growth rate of what kind of thing? And also, given that the seafood market was closed on the 1st of January, do we think that all the new cases now are being human-to-human transmission, or is there still animal sort of contact? I mean, what do we think about where the cases are coming from?
So, simple answer to the first question is no, we don't really have enough information to say anything about the growth rate. There clearly is ongoing transmission. There are reports both from the exported cases and some mostly unofficial reports from within China of recent disease onset. I mean, people who have developed symptoms just in the last few days. And given the markets have been closed for a considerable period of time and infections have occurred outside that province, clearly some human-to-human transmission is going on. What we would like to have is a list of all the cases when they develop disease onset. That would allow us better to really track the epidemic. We don't have that at the current time. Furthermore, even if we had that, there has clearly been a massive, just in the last week, a massive ramping up of the response in China, a massive ramping up of testing. And so any trend we see could be as much a reflection of increasing testing, increasing surveillance, as really an underlying growth in case numbers. It will take a considerable time for these uncertainties to be resolved. If we assume this virus is transmissible from person to person, then the growth rate could, because there is a long incubation period, a long period of infectiousness, the growth rate of this epidemic might be really quite slow. It might only double, for instance, every 30 days or something. So we are going to have to be patient, both for the technical challenges of actually understanding virus transmission in a new virus in real time, and just because of the intrinsic dynamics of any epidemic which may be occurring.
Yeah, right. I think it's it's crystal clear that there's person-to-person transmission. There's no way you're going to have 400 cases, all linked to this food market, and many of the cases, and a decreasing proportion have reported any link. But the critical question is, how transmissible is it? Is this going to be sustainable?
Okay, quickly, anyone on the phone want to ask a question? No? Okay, so...
Yeah, I've got one.
Yep.
Alex Lee, Wired Magazine. I'd just like to touch on, you answered this briefly, but I'd like to probe a bit further on Chinese New Year. Is the spread of the coronavirus going to be exacerbated due to mass migration? And how are they going to be able to contain it with all of those people moving 3 billion trips estimated?
Yes, as I said before, I mean, the epidemic growth, if there is an epidemic, and I say it's a big if there is an epidemic going on, its growth won't be particularly exacerbated by Chinese New Year. People just moving doesn't necessarily increase spread. But clearly the geographic extent of the epidemic will grow faster than it would otherwise. As I said, there's roughly a doubling of internal travel in China during Chinese New Year, maybe a little more, and of the order 30 to 50% increase in international travel. So it is a concern. Chinese authorities are aware of it and are introducing screening and checks in major transit hubs, but there's a limited amount we can do.
Okay, any other phone questions before I go back to the floor? Okay, no, right, okay. So you, and then Colin, you, Nina, right.
So you have to speak up a little.
This virus mutation contagious or how likely?
So genetic sequences of this virus have been released, a limited number thus far. They show quite a slow mutation rate, but absolutely, this is what's called an RNA virus. RNA viruses mutate all the time and do change. As to your question of could it mutate to become more lethal or more transmissible, that is speculation. We have corona. It could equally mutate to become less. It won't mutate to become less transmissible. Perhaps the biggest risk is as cases accumulate, it evolves to become more transmissible. That increases the fitness of the virus in the human population. The relationship between fitness, which is the driver of evolution, and lethality, though, is much more complex. The coronaviruses, and Peter can talk more about this, which exist in the human population all the time, generate very mild disease. They're one of the significant causes of the common cold. They probably kill no one or very, very few people. So it is entirely speculative as to what the long-term trajectory of this virus is. But at the moment, the mutation rate is such that it will take many, many-fold more cases, even based on our estimates, to accumulate before we likely to see really major changes genetically.
Okay, Peter, do you want to follow up at all on that? Or?
Well, I think it's the point that Neil made is it's an evolutionary process, and it really depends on, the more transmissible viruses will be more fit, and they'll be more successful. But if transmission is more common in a mild case than a severe case, Because the severe cases stay at home or go to hospital, then you may see that the milder viruses also have a competitive advantage. But we just don't know which way it will go.
I mean, it's entirely speculation at the moment. We just don't know.
Okay, I'm sorry, I don't know your name.
Hi, Sarah Newey from the Telegraph. We've seen cases in the US now, so do you think we're likely to see a case more in the UK, especially if we have direct flights?
I mean, so are we like... I mean, there's a probability that we will. Whether we will depends on how quickly cases continue to grow in China. If this outbreak is fairly rapidly brought under control, then we may escape any imported cases. The longer it goes on, the higher the chance becomes that, yes, the virus will reach Europe and potentially the UK.
Can I just follow up? So the case in the US, from my understanding, is that person was aware of the outbreak occurring in Wuhan, and so had self-identified that they were feeling unwell. They had travelled there and they went to their local hospital to be able to say, I think I may have this. And I think that awareness that that you may be unwell, it may be related, I think that's really important, and that's a message that we all should be sharing with the public, irrespective if it comes to the UK or not.
Colin?
Why is it only older adults that get in the disease? Is it just that they go to the first question? I've just got another subsidiary question. Why are these diseases always coming from Asia? And is this something they should do with the way they keep animals?
So I would be cautious about saying it's only older people. We have limited information. Certainly it's true that for the number of the severely ill people, we have some information about age, and they are older, but the age range of diagnosed cases is quite broad at the moment. I think the youngest is 13 or 15 years old, and we don't know the distribution. Peter was referring to the fact that we might expect, given what we know about which subsets of the population are most at risk of severe disease for respiratory viruses, we might expect older people to be more vulnerable, but really there's still a lot of uncertainty about that for this virus. As to why is Asia a big source of respiratory viruses, there are a number of factors. Probably the single biggest one is that it's a large source of people. We have, China has, 1/5 or more of the world's population, and so we would expect by chance just viruses to emerge there. There potentially are some, and then behavioural risk factors. Having live animal markets clearly is known to be a risk factor for the spread of viruses from animals to people, as compared with this country where we go and buy pre-packaged meat from supermarkets.
And I think the paediatric, the children question is really important, because there's human-to-human transmission. Why would children not get infected? One would expect it, unless there's some way that the transmission is happening which is not related to just normal interactions. But it could also be that children are getting infected, but they're just not getting significant disease, and so they're not being taken to see doctors, and they're not being diagnosed. And that's an important thing. I think we really have to look at children with respiratory infections and see if they are being infected with this new virus.
Right.
Hello, it's Sophie Hutchinson from the BBC, just on the telephone. Could I ask a quick question?
Yes, very quickly, yeah.
It's just picking up, clarifying, just looking back in my notes where you were saying, or I think it was Peter maybe saying something about the hospitalised cases. Was it that they were mostly adults, no children, 40 years plus, so older people? Are we talking about the current outbreak, that none of the hospitalised cases are children at the moment?
Yeah, from what we know, I mean, obviously we're only getting partial information, and we understand that there's been a lot more admissions recently, but from what we know, the average age is in the sort of, the 40s, 50s and older, and I'm not aware of any hospitalised children.
Okay.
That's really helpful, thank you.
Yes, sorry, I don't know your name.
Sam Van from the Mail Online. I think, Neil, you said earlier that the UK government did a worse job of containing it than China. Why did you say that? And also, are there things around now that make it more complicated than containing the SARS virus 16 years ago, like touchscreens, tourism, things like that?
So, I mean, slightly facetious comment saying that the UK would be worse at containing it. I mean, it's partly because the Chinese authorities can implement measures which probably would not be acceptable in the UK. If you look at what was done to contain the SARS outbreak, there were tens of thousands of people in isolation. We could not implement such a policy in the UK. As to your second question, without doubt, compared with SARS, I mean, global travel has more than close to doubled. I mean, mostly, I should say, short-haul regional flights, but I mean, it's an enormous increase. That doesn't necessarily, again, amplify an epidemic per se, but it means that global spread is faster than in the past.
Yeah, I'd also add that the patterns change. There's a massive increase in the traffic between Asia and Africa now, which wasn't the case 15 years ago, and I think that's an additional risk that we should also be looking at the African continent and their preparedness.
Right. Nina?
Were it to reach the UK, how would we cope? What would be the most effective measures to take?
So for this virus, and it's a good question because we haven't addressed it yet, how can you stop spread? Given that we don't have any vaccine or treatment, the measures we have to adopt are so-called, isolating cases as diagnosing and isolating cases as quickly as possible, so they're unable to transmit onwards. Ensuring then what's called contact tracing and follow-up, so identifying who those cases have come into contact with, and if not isolating them, tracking them through time, daily or more frequently, to see if they develop symptoms and testing them. Then in some circumstances, these are the sort of measures which have been adopted in past epidemics. You can try to reduce community transmission through what are called social distancing measures by reducing occurrence of mass gatherings. In the case of flu, which affects children more, potentially closing schools. But as Peter said, at the moment we don't know the extent to which children might be affected. So there are a set of measures which have been developed over really from the last century, really, the evidence base has built up to how we can attempt to control spread of viruses without vaccines or drugs. It is very difficult. So we don't know at the current time whether we will be able, if there is a growing epidemic, whether it is controllable.
Right. Yeah.
Are people being allowed to leave Wuhan? I've heard reports saying that pretty much.
I mean, it's a fast-moving situation. The last I heard is people were, but there were a lot of checks on both train terminals, rail terminals, flights, airports. That situation. I haven't heard that yet, but I may be behind the times.
I heard a news report that people in Wuhan were being advised to stay there, no one to go there, no one to come out. But in reality, this is a city of 11 million people. It would never work. Not even in China to quarantine a city of that size.
I'm also interested in what you said about how the measures that the Chinese authorities have implemented would not work here. Why would they not work here?
Well, to be fair, the measures the Chinese authorities have implemented thus far could be implemented here. However, we will see what happens in the next few days. The Chinese authorities have much more leeway to introduce more draconian measures we might view as draconian, such as isolating a city, and the capability of doing it in a way we could not. Also, I mean, despite the very large population density in China, cities are further apart. We're a very small island with huge amount of mobility. That said, the measures I talked about around case isolation and identifying contacts, potentially quarantining contacts, those measures we can introduce. So the success will critically depend on how successful of controlling this overall will critically depend on how successful those measures are. That itself depends on how transmissible this virus is and all the things we've talked about thus far.
Right, we've got 1 minute left if there's any last questions, but if not, I will finish that. Oh, right, Sarah, yes.
Just a quick one, Sarah from the Telegraph. Might it already be here? Is there a chance that it can be here and it's just not being picked up
I mean, we can't rule out that possibility. Border screening and, in this case, in the UK, the alert in the health system is not 100% foolproof. There could be a mild case which is recovered. The UK is not a major destination of visitors travelling out of Wuhan around the world, though. So I would say it was unlikely, but we can't be completely sure.
Right. Okay, I'm going to stop there. Massive, massive thank you to you three, and sorry again about David's slightly odd phone call that didn't work, but yeah, thank you so much for coming, and thank you for coming as well. And yeah, they'll be around for a little bit longer should you want to do any follow-up questions or interviews.